Hi, everyone. Good morning. My name is Jillian Parker, and today I'm joined by Dr. Stephen Schulz, a pediatrician with Rochester Regional Health. We want to talk about the newly released guidance from the American Academy of Pediatrics, otherwise known as the AAP. Anyone who has any questions while we're conducting this interview, please feel free to leave them in the comment section. We'll circle back around after we're done. So the new guidance that was released that all children over 2 years old and all school staff should wear face masks while at school, regardless of whether or not they've been vaccinated, whether or not they've gotten the COVID vaccine. Dr. Schulz, can you just go into a little more detail about that guidance? I'm sorry, you hear my dog barking next to me, working from home, about that guidance and, ultimately where that, what data they use to come up with that guidance.
Yeah, so I think one of the big keys is after over a year now of dealing with this, we know that there's data that supports things that can keep schools open. And we know that there are things that protect against transmission of COVID and spread of infection. And so we know the most effective way to prevent COVID is to get vaccinated. That's far and away, number one, the best thing we can do. The problem with schools is that majority of kids in schools are not eligible to be vaccinated because it's only for 12 and up, and that's Pfizer only. And unfortunately, for those that are 12 and up, many still are unvaccinated in that age category, and even some teachers and staff are still unvaccinated, unfortunately, and that varies largely depending on your locality and where you're at. So there's going to be risk for that. And even though we're seeing the country as a whole maybe start to turn a corner in a lot of ways, unfortunately for kids, they're still at extremely high risk because they just, again, most of them aren't eligible to be vaccinated and have yet to be vaccinated. We know that social distancing works. We know that masking works. We know that increased ventilation, which is why it's a plus to be outdoors, and other environmental controls can work. Testing and those sorts of things, identification, quarantine, all those things can work. And so, it's taking this in a layered approach. And the reason that the AAP has come out with more conservative measures is that, our focus is really on children as part of the American Academy of Pediatrics, and we want to keep kids as safe as possible and keep schools open to in-person learning all year long.
When it comes to infection rates, I know that, the infection rate among kids when it comes to COVID-19 has changed over the last few months. Can you talk about where we are just specifically with kids right now?
Yeah, and so for the Delta variant in particular, it's much more infectious. And, I guess to start looking at the overall picture, we're really starting to see this be a pandemic of the unvaccinated. Across U.S. hospitals, the folks that are hospitalized, 97.5% are unvaccinated. Of COVID deaths, 99.5% are unvaccinated. So again, vaccines are far and away the most effective way to prevent the spread. The Delta variant, which initially started in India and caused a major outbreak and pandemic there, is the predominant strain in the U.S. now. I just saw a highlighted article this morning that it makes up now 83% of the sequenced cases in the U.S. So it is more infectious. And in terms of pediatrics in general, cases have doubled from late June to currently in terms of COVID cases.
How will this new guidance, now I know that it hasn't been adopted by New York State yet, it's not mandated, but how could this new guidance potentially impact schools? Is this something that schools are going to have to follow, optional guidance, and does it have to be state mandated?
I would strongly recommend that schools do follow through with this, for a few reasons. One, administratively, it's really difficult to keep track of who's vaccinated and who's not vaccinated and enforce it for some folks and not other folks and those kind of things. So, really, the safest thing is to continue with the masks, again, especially knowing that so many folks aren't vaccinated. This is a little bit of a change from the CDC's guidance, and that's okay. Again, the American Academy of Pediatrics is really focusing on kids and keeping kids safe throughout the year. And the CDC guidance does allow for folks to be a little bit more cautious. And we have a highly unvaccinated population. We're going to want to be more cautious with kids. Where the rubber really hits the road with this is going to be what the New York State Department of Health decides to do with their guidance, and that's going to be what directly impacts our local schools and where any additional variations might exist moving forward.
That was going to be my next question for you about the CDC, the difference in the guidance between what the AAP is recommending and what the CDC is recommending. Can you explain that difference and what you recommend?
So again, the difference is really that the CDC's guidance came out and said that if you're vaccinated, whether you're an adult as a teacher or staff or a 12 and up adolescent who's vaccinated, you don't have to wear masks. The AAP is recommending masks for all, regardless of whether or not you're vaccinated. And again, there's multiple interventions and strategies and a layered approach that we're looking at and trying to keep kids safe and schools open. And the AAP is just being a little bit more conservative to try and protect everybody out there and prevent transmission in any form. And I think that's a positive thing. We've seen what the negative effects have been from school closures and virtual learning. So.
Is this going to apply to college-aged kids or just for kids through high school?
Right now, we're just looking at this kids through high school. College-age kids, it's largely going to be up to the colleges themselves. I know that New York has put out a vaccine requirement for the SUNY schools. Private colleges are going to be just making the choice on what they think is best for them.
With schools that implement this guidance, how do you think it's going to impact children? Will we see a difference in the impact, such as for kids in elementary school versus middle school or high school?
Yeah, I think that we're going to really see this benefit anybody who's unvaccinated, regardless of age. And so again, that's kind of the key point here is that vaccination is still low in schools. And especially elementary and early middle schools, there's just not going to be enough vaccinated folks. And we saw last year that the schools did an excellent job of putting into place all the mitigation measures necessary with social distancing and masks and things like that to keep schools open throughout the year. And that was fantastic to see. So that was even without any vaccines for a vast majority of the year, including for teachers and staff. And so we know that this works. One of the biggest hurdles last year for schools opening full time was the social distancing measure. And there was the 6-foot requirement in place. And that's what kept a lot of folks hybrid or, prevented them from fully reopening. And now that that's been relaxed, the masks become even more important when we're just looking at a 3-foot social distancing measure and preventing the spread among unvaccinated folks.
I just want to jump in and reintroduce ourselves for anyone who's tuning in halfway through. We are talking to Dr. Schulz about the AAP's new guidance. This is recommending children over the age of 2 and staff in schools wear masks come this fall. Is there a concern that this guidance will make parents less inclined to have their kids vaccinated?
My hope is really that that's not the case. We know, again, vaccination is the most effective way in preventing illness and transmission of COVID. And so I really hope that parents would take the opportunity to vaccinate their children who are eligible because we know it provides a lot of freedom for those children and really protects against illness in a high level. And so I would strongly encourage them to continue to be vaccinated, even if there's not certain freedoms allowed in school.
Could we, do you foresee there being changes to this guidance once everyone is eligible for the vaccine?
And that's certainly possible. I know that most recently we've been looking, kind of midwinter for when it might be approved for younger kids. And, that's just when the approval happens. And then there's going to have to be the ramp up of, getting kids vaccinated and getting the vaccine into clinics and all those sorts of things. So, I think throughout this school year, we're going to see the need for all these mitigation efforts. And again, this layered approach to continue.
Do you foresee recommendations changing again before the school year, or do we really think that's going to be more as that eligibility group expands?
Yeah, exactly. I think it's going to be more as eligibility expands. And then, also, again, we're seeing an uptick in cases with the Delta variant and, increased spread throughout communities as some of these masking regulations have been relaxed across the country.
This past year, some parents still, their kids were homeschooling full time. Any advice to parents as they get ready to make that transition with their kids back into the buildings?
Yeah, I think it's a matter of preparing the kids and having discussions with them, encouraging them to connect with friends in a safe way. We know outdoors is a good way to go, and having those interactions while masked. I think a lot of schools are reaching out to parents and doing some preview days and things like that, and getting kids accustomed again. Again, I think most schools in our region have been open throughout the pandemic, and at least on a hybrid level, most fully in person. So for many, I don't think it's going to be quite as much of a jump, but you're right, for some of those that have been virtual all year, it's definitely going to be a little bit more of a challenge. And I would definitely encourage any parents who have kids that are struggling with that transition to reach out and talk to their primary care provider, to their pediatrician, to their family practice provider to help guide through that.
There are a lot of different types of masks that are out there. Do you recommend any specific type of mask for young children? I don't know if there's a certain age range that you recommend a specific mask versus those who are older.
Yeah, not in particular. I know that the valve masks that are not thought to be as effective, but any cotton cloth mask, or if you wanted to go the route of the surgical masks, are certainly appropriate.
Is there anything else that we haven't touched on when it comes to this new guidance schooling that you want to add?
Again, I think the bottom line with this is vaccinations are the most effective way to protect against getting COVID. We know that the Delta variant is spreading and more infectious. And this really boils down to us really wanting to keep kids in school and keep them safe throughout the school year. And, we really saw last year the educational negative impacts. We saw the social, emotional, behavioral, mental health impacts, even the physical impacts and weight gain and those kind of things that came along from kids having to do the homeschool or the hybrid schooling and virtual learning. And while it might have had its highlights in certain areas or for certain kids, on the whole, this has really negatively impacted kids. It's taken away from the supports that they have in school through caring teachers and staff, through friends and interactions, through extracurricular activities. And, everybody wants to get back to normal. And we're following the science. And this is really the safest way to get things back to normal.
Dr. Schulz, thank you so much for taking some time to go through that new guidance and what the school year could look like coming up this fall. Everyone tuning in, again, if you have any additional questions, please leave them in the comment section and we'll get back to them as soon as we can. Dr. Schulz, thank you again and stay safe, everyone.
Thank you.